Hello and welcome to a brief video about how to relieve the pain, burning, numbness, or tingling from peripheral neuropathy without drugs or surgery. Who am I? I'm Dr. Jason Kelberman. I'm a chiropractic kinesiologist who's been specializing in the care of peripheral neuropathy. We're going to focus on non-invasive, FDA-cleared neuropathy protocols today. I've been treating many different types of peripheral neuropathy cases for the past 18 years. I've learned from doctors all across the country. I've invested time, resources, into getting the very latest specialized equipment and training, as well as patenting one of my own called Foot Power. We're going to go over some statistics about peripheral neuropathy, common causes, how is it diagnosed, what are the symptoms of peripheral neuropathy, what are typical treatments, and what do we do that's so different? Let's start by going over the words. Peripheral, hands or feet. Neuropathy, damaged nerves. Some statistics. There are at least 20 million Americans suffering, and this is underreported. Not only that, but there are 86 million who are pre-diabetic who are at high risk for developing peripheral neuropathy. It's more common in men than women, but getting pretty close in average. The average age is 62 or older. Some of the common causes: diabetes and pre-diabetes. Even if you're not diagnosed as being diabetic, you can still develop peripheral neuropathy. Chemotherapy is common. Toxic syndromes, heavy metals. In fact, the younger cases that come in are usually the toxic and heavy metal syndromes. Drug-induced. There are 68 drugs that can cause neuropathy. Statins for cholesterol is probably at the hit parade there, number one. Traumas to nerves. Autoimmune, COVID-19, we've seen tons of cases over the last 3 years. HIV. Idiopathic simply means unknown causes, and spinal stenosis, which basically means your spinal cord is being choked off and it's affecting the nerves that go down your leg. How are the nerves classified? Well, there's motor nerves, those that control your muscles under conscious control. There are sensory nerves, which transmit information like touch, temperature, or pain. Those are the ones that are very frequently involved with peripheral neuropathy. And there are autonomic nerves. These are nerves that control the organs to regulate activities such as breathing, digestion, heart, gland function, etc. How is peripheral neuropathy diagnosed? Well, health history is so important. Physical and neurologic examination. And in the medical world, they conduct nerve conduction studies and EMGs, electromyograms. We also use MRIs or X-rays of your spine, and often we use a Toronto clinical scoring system to determine whether you are in a mild, moderate, or severe situation. Symptoms: pain, burning, cramping, tingling, numbness, weakness. What are the typical treatments for peripheral neuropathy? Well, in the medical world, the two drugs that are most commonly used are gabapentin or Lyrica, although lately gabapentin seems to be the number one choice. If it's a nerve compression syndrome, you can lead to surgery. The podiatrists often use orthotics or braces or special shoes. Laser therapy, or laser neural relief as we call it, is one of the latest and very effective. And then there's TENS therapy, and we can discuss why I don't think TENS therapy is safe. What do we do that's different and effective? That's why you're listening to this video. Well, we have a comprehensive protocol to address moderate to severe peripheral neuropathy, which is very successful, 80 to 90%. It's practiced by specialists around the country, helping thousands of patients. We use FDA-cleared therapy devices, and it is natural, non-invasive, and the patient feels no pain while it's being done, and we get long-term success. What does the neuropathy protocol consist of? Well, at Westside Wellness Center, we are the only office in Los Angeles to offer all of the following protocols under one roof. Foot Power is my patented foot strengthening device that helps your foot not only regain its power because it has been lost by nerve damage, but it also helps to increase circulation and balance therapies as well. We use class 4 laser therapy. Love class 4 laser because it can go deep inside of you, up to 4 inches, to bring oxygenating light therapy. It's a metabolic stimulant. The latest is RST Synexus. This is specialized electroanalgesia. It's also called electro reprogramming. Okay? This therapy I brought on just recently because it excels at removing numbness. You would think that pain and burning and tingling are the hardest symptoms to get rid of, but they're not. The numbness is the hardest because numbness is the result of real nerve damage. And so the Synexus unit is amazing at that. We're getting phenomenal results. Spinal decompression. If you've got herniated, protruded, extruded discs that are creating problems on the nerves down your legs or your neck into your arms and hands, this is an amazing therapy that helps us rejuvenate, rehydrate the spinal discs that are the cause of that problem. And I've also developed specific chiropractic foot alignments, which are pain-free, and we use that in conjunction with kinesiotaping for stability and then foot strengthening to bring back the power and stability of your feet. I've also developed custom metabolic nutrition. Since I've been doing this for so long, I've noticed specific patterns in the people who both have many different types of peripheral neuropathy, and I've combined them into 1 or 2 formulas that help alongside the modalities and physical treatment in the office. We call it LSN. It stands for liver support, sugar management, and nerve rejuvenation. Custom, found only here in my office. What's the goal of our neuropathy protocol? Well, the ultimate goal is to increase blood flow to the feet. And sometimes we have to work the entire leg and other areas, including lymphatic supply, to get the flow down into the feet. The ultimate is to oxygenate by bringing not just blood flow, but using modalities and reprogramming nerves to allow your body to get in there and to do its true healing and see how much nerve regeneration can occur. Along the way, we are absolutely resolving symptoms. Usually pain, burning, and tingling are the #1 symptoms that go first, and the numbness comes along later. Is the protocol safe? Absolutely. It's FDA cleared, it's very gentle, the recovery rate is 80 to 90%, and the research behind it is excellent. I often get asked, why isn't it covered by insurance? And my answer is, I don't really know. It is extremely effective, but in our world, things that are effective is not the criteria for whether or not they're covered. All right, and so with part of it is that the latest technology just doesn't get absorbed into the medical stream for a decade or so, and so the treatments vary greatly depending on your severity. If it's mild to moderate, it's on the lower end. If you are severe, we need to use multiple treatments all at the same time, and sometimes even home therapy to try to stimulate nerves, because nerves heal very, very slowly. It's not like a muscle, where 3 days to 3 weeks, I give you some home exercises and it goes away. Nerves that are damaged need constant stimulation and proper stimulation, and they need continual, consistent care. How to determine if you're a good candidate? Well, the initial consultation, health history, and most important, the comprehensive examination. If you are mild to moderate or moderate to severe, you're a good candidate. If you're severe and your nerves have already been dying off for so long that there's nothing left, I'm afraid you will not be a good candidate for this particular type of therapy. We also want to review any imaging, MRI, X-ray, etc., and your blood work to coordinate that into the decision-making process of whether you're a good candidate. And that's one of the reasons why we offer a special. Now, what did we cover today? We did some statistics on how many people are affected by it, what common causes of it are, how is it diagnosed, what are the symptoms, what we do that's different in terms of treatment, and why we're so different. We are the only office in California that I am aware that offers this comprehensive program where we can deal with the metabolic components, the physical components, the neurological components, all at the same time. And it's why we get better results. We treat the whole body at the same time. So what do you do now? Well, the good news is I'm centrally located, serving Greater Los Angeles, and you can book a new patient special in which I'm offering the entire consultation, examination, and review of any of your records for just $97. I do this so that you don't have to invest a lot of money to find out if you're a good candidate. If you're not, I'm going to tell you that you're not. And if you are, I'm going to give you a protocol that will help you get the symptoms of peripheral neuropathy under control so you can get your life back. Call 310-268-8008 today.